You are good.
But do you need help with the camera?
No, we're rolling. Well, good morning, and thanks everybody for being here. And thank you for allowing us to start a few minutes late while we got logistically set. We have a mix of Impact Council members and staff from United Way and NBN, and this is your time to share with us kind of your elevator pitch, emphasize things that maybe you didn't feel like you had an opportunity to do in the application, and really more of a discussion more than anything. So I will turn it over to you, and we'll go ahead and get started.
Thanks, Alana. And for folks out there in video world, hi. Sorry you're not here. My name is Burt Wood. I'm the president and CEO of Insight Human Services. With me today is my good friend and longtime colleague, Michael Gray. Michael's our vice president for Justice Services and runs a lot of our services you'll hear about in a little bit. Hello.
Hey there, Rachel. We just got started.
Okay.
Rachel Damaris.
Hey, Rachel, I'm Burt. Hey, this is Michael. Michael, nice to meet you.
Nice to meet you. Hey, Rachel. Hey.
So I trust everyone's read the proposal and knows a little bit about us. Insight's been around for a long time, and Insight's been a partner with United Way for a long time. And we're really excited about this process to do something more and something different than just the same old, and do things with you and in different places. For too long, we just keep doing the same things, expect different results. And, unfortunately, our business is good, but it's going to be impacted as we do things differently. We're really excited about some of our evidence-based services and doing things so that we make a difference and enhance lives. So we're talking to you today about the Insight Skills Development Program, and this is a really innovative process. It's an evidence-based service that helps persons who are unemployed or underemployed gain employment, keep employment, and hopefully advance in employment. Those are three different things. One's getting a job, two's keeping a job, three's getting a raise or doing better and expanding in that job. That's important for a lot of reasons, but I'm going to now brag about the Impact Council and the civic proposal. The number one guiding priority that I don't think many, if any, of your other 25 proposals addressed is looking at job placement and skill development. That's number one on the RFP, and that's what we're doing with this proposal. Number three on the guiding priorities is looking at preventative health care and emotional behavioral screening. So, ladies and gentlemen, two of the three top priorities, guiding priorities that the Impact Council, the residents, that United Way staff and others have felt important in the community here are those kinds of activities. This was tailor-made for that kind of priority and important because it's often neglected. I don't know who all your other proposals are, but I know some of my colleagues, there's a lot of focus on early childhood, middle school services and other areas, but it's essential to make big difference that we look at employment and employability and engagement and getting living wages and getting benefits. And without that, we do all the values clarification and helps that we can for fifth graders, but we think this is a very surgical, tailored approach to what we're doing in the civic proposal. So I'm not going to use too many these big words. I'm going to start using government initials. So what we're doing is cognitive behavioral intervention, but we're calling it CBI, y'all. But cognitive behavioral intervention is an evidence-based curricula that helps people improve their self-esteem, their social skills, positive relationships with employers, co-workers, exploring their own values and responsibility and decision-making. CBI is evidence-based. Again, I don't know your other 25 proposals, but this evidence-based activity has been researched in 120 different research studies and has shown it's effective in making a difference. Michael's going to tell you a little bit about it, and depending on what questions the group has about some of the actual content of the curricula. We've been doing over on 4th Street a CBI class that's more directed towards folks coming back into the community from jail, prison, they're on probation, or leaving the hospital. This CBI class we're proposing here on New Walkertown Road is more focused on employability and employment attainment as opposed to getting the probation officer off your back, because we think that's important. And people got probation officers on the back and come over on 4th Street, but what we're doing here is working with folks who are looking at under or unemployment. So while I'm talking about the word evidence-based research, besides CBI having 120 studies, Michael and his staff are trained in motivational interviewing, known as MI. And so it's really important that we don't talk down with or to folk, but look at motivational interviewing and enhancement therapies. Again, another evidence-based approach that we'll do in the programming. And the third evidence-based area, which I'll talk about a little bit more if you want, because you said what I'm excited about, is contingency management. Contingency management is a big word for incentives and rewards. And y'all, the shorter word is bribes. But evidence-based contingency management engages and retains people. And we know we know the services that are needed and who might be attending them, and we know incentives work. And so we're using contingency management, which we'll be real excited about. So those are the three big things I'd like to suggest to you are really important. One is the number one priority for the guiding principle. Number two, it's an evidence-based service. And number three, it works. A few other points I'd make. One is in proof in all this, and right around Christmas, the holidays, it's a little bit confusing to me about what we said, because we said two different places, but the classes are going to help, and 70% of the people are going to make it through the classes, are going to complete the classes, or principally complete the classes. They miss with the flu or snow days, or don't have a babysitter or things, and we didn't have the child care range. And then we said somewhere between 55 or 60% will get a job in 90 days. That's a coin flip. I made that up, but I believe it's possible. I don't know if it's probable or not, but that's our goal towards which we're going to work. Because I thought it would not be a really good shot to say we think 40% of people will get a job, nor are 100% of people ever going to get the job. But we're shooting for 55 or 60% of people within 9 days are going to be employed, that if they successfully complete those classes. A few other quick points, see what questions you have, hand off the mic. One, this is an effective way to invest these services in the community. We're not asking for a lot of money, and I don't mean to say that's not a lot of money, $51,000, but we're looking at a half-time person with those benefits and with the workbook and with the contingency management and with child care with two of our partner agencies, and with, as needed, goodwill training programs, including transportation. And for all of that, for $51,000, sounds to me like a really good deal. Second thing I would say is, when we talk about how we're going to work with the community and continue to enhance what we're really excited about that the neighbors are doing, and looking at the ABCD training that we went to, I'm reminded again and put in the proposal, we're not doing services to people. And we ain't doing nothing for people. We're working with the community and doing this. And our commitment will be strong in that area, as we noted earlier before Rachel and some of those got here. We're doing the parent training and prevention services at the Salvation Army International Center here on New Walkertown Road now. We have a proposal pending, and some of you guys were at yesterday, related to Carver School and a resource center. So we're really committed and excited about further engagement with not only the residence councils, but with the faith community and with other leaders in making this happen. So I'm going through my points based on the questions that Ucha had listed too, is how do we know it's sustainable, and how do you know you can actually do this? Because y'all, 150 people is a big reach for the first year. It's a tough population. And the way I made that up is I said we're going to do a class a month and have 12 people in each class. Do we think that's attainable? Yes. And the reason is because this is important service and it's going to be conveniently located and it's needed. Besides contingency management working, we know another thing that works for folks, and that's called coercion. I mean persuasion. And there's some people that can be persuaded to go to this class. And if you're persuaded to go to this class, that will help build up the momentum and also create more interest in it. I asked Michael last night, he pulled out this morning, I said, how many people have we worked with in terms of doing these kinds of services in the community? And in Justice Services, last 12 months in Forsyth County, Michael worked with 1,077 folks in tasks. We worked with 579 people in CBI classes over the last period of time. And that doesn't count our treatment services down on 4th Street and in the community for about 1,100 adults and 650 kids. So we're a high volume dealer, if you will, but this is specialized and really important and really exciting. The last big question, how's it going to be sustainable? Gosh knows if this state will ever expand Medicaid. Gosh knows if the economy is going to actually trickle down to all of us versus the three folks we were talking about earlier. But what we do know is this: one, this service is important, it's effective and efficient, meaning we can afford it, and we've got evidence of what we do getting picked up and it works. So for example, one of the things we're doing is called another initial, sorry, SBIRT, Screening, Brief Intervention, Referral to Treatment. You don't need to write that down. But what that means is we got a professional counselor in doctor's offices. We are one of 2 pilot sites in the state to do SBIRT. We have 2 bilingual licensed counselors. I'm pointing down to the community care center. And they're bilingual and they're screening people to come in for their scripts or for their other health needs, and they're getting screened for behavioral health issues. We are so good, or that service is so important that Wake Forest Health has picked up one of our guys, stole him from us, and now he's helping do those SBIRT services in other Wake Forest practices. So it's a pilot program that's now become evident. I'm brag on Michael. Michael started CBI classes in 11 counties. Michael and his vice president out in Nashville. CBI classes in 11 counties for the Department of Public Safety. Yes. DPS, we used to call it Department of Corrections, DPS. And we're so good, or that services is so needed, or no one else wanted to do it such, that we applied to do that in 25 counties, and we got all 25 counties awarded to us. So when you talk about sustainability or ability, I think we kind of got that. So last thing I was going to say, Alana, y'all said, what am I excited about? I could say about anything. But what I'm excited about that I really only said 2 sentences about this proposal was the issue of the contingency management or incentives and rewards. And this is what I wrote down. Engaging and retaining folks is a challenge. Anything we're doing, that's a challenge. It's a really big challenge related to this population. But what we know is contingency management works. It increases attendance. It increases completion and success. And we've got it already embedded in the program, contingency management, in really cheap ways. We got bus tokens. We got van service. We got child care provided. All that's included in it. And then that last other duties as assigned thing is we can do incentives and rewards pretty efficiently they do things like fish bowls, and everybody who comes in gets to draw something, and sometimes it says you're doing great, and sometimes it says you win a Big Mac and a Pepsi, or a dozen donuts, real healthy, or a thing. So the contingency management gives rewards and engages people and looks and looks and say, see what I'm going to win. Am I going to win an attaboy, or am I going to give me a Big Mac?
Healthy living is one of our
So I did a veggie wrap. I sounded like Big Mac. I said veggie wrap.
That's what you said, okay.
But that's cute. But that's one of the things I only had a sensor to in there. But you guys know more than most how tough this is, and we've done that. And we think that kind of contingency management, evidence-based services, kind of flew under the radar with first proposal. So I talked about CBI, and if we're not talking too much, Michael, if you'll give them like a 3, 4, 5 sentences about employment in CBI.
All right. Like Bert said, I'm Michael Gray. We are actually using this model now, and it's an evidence-based workbook, and each participant will get a workbook. But one thing I'll add before we get started is that employment is a key piece to success in the program. So I've been here 25 years, and I work with substance use disorders, I work with mental health, I work with homeless, work with development disability. And employment has been a key to success in the programs. I got a person that's using marijuana. They might not want to stop, but if they know they got to stop to get a job and they need a job, that is help. I'm not a doctor and I'm not a researcher, but if I had to do a research, I would put some money on that employment is a key to helping someone to get drug-free, someone getting back on their feet, because that's one of the challenges coming out of prison and the jails. I don't have a job. So employment has been a key piece in justice services, because we've seen a big turnaround in clientele's behavior, the drug use when they have a job, somewhere to go and something to do productive. So I think I'm glad that the council is looking at this particular piece to be an important part of this journey. Because in my master's program, I did a research on that it's better to keep a bad employee, to get them to be good, than to just hire a new person. And that's what my thesis was on, and there's evidence out there to show that you can save a person and save the agency a lot of money than just firing them. So employment is out there in society, and it's a good piece. In my present program now, we're using this, and this actual evidence-based practice gets the participants to kind of take a look at themselves and say, first of all, what do I want to do? Sometimes they don't know what they want to do. Am I employable? Before I even go out there, are there some things I need to work on? Because you just can't walk out there to a job and you don't even know how to get up and come to my class on time. You know, so it's some things that they need to learn. So in these different modules, we first start with job readiness. I don't just need to send you out there looking for a job till we start looking at some job readiness skills. In my department, because they have been locked up sometimes, they have done that in prison, and then some who get placed on probation who've never been there before, we do those skills. So this book first talks about job readiness, and then they get to examine, are you a good employee? You know, because some of them don't know what it is good employment. So long as I get to work, I'm happy. Well, no, if it said be there at 8:30, I think you might want to get there at 8:15 if you're ready, ready to start today. So it gets them to look at that. And then it also talks about who to hire. Different jobs for different folks. We want to keep it realistic. You don't want to be a brain surgeon, you don't have a degree. So some of them be like, I want to do X, Y, Z. So we want to make sure we make your goal, attainable. So that first module is just about looking at yourself, making sure your job readiness, and kind of like who to hire. The second module goes to exploring themselves. What do you want? What type of job do you want to do? And let's identify your skills. What are your skill sets? And what type of skill sets do we need to, enhance, so that we can make sure that you're ready to get you, kind of out in the field. And then the third module is, once we've done that, is once you get a job, what are some problems it is getting the job? So we can see what your barriers are, and what are some problems for you to keep a job. Because some people can get a job, but they can't. They'll come in, they might not have a resume, but they can say, I've worked in 5 places, and we'll say, well, why you have been working there? And they'll say, well, I was late, or, I had a positive drug test. So we try to look at those different circles, and we also try to look at their own behavior. Why do you get upset at a job, or why can't you keep a job? Because with the evidence-based practice, not only do we want to look at what they can enhance, we want them to look into the inner self. Look at your personality and what's going on, with inside of you to make you a better person. And then some who may get in this program and have a job, it can still benefit them, because we can get them to look at what are you doing to sustain your job, and would you like to get promoted, and what are some things that you might need to do to get promoted, because you might be at McDonald's, but people come in after you and they become managers. What are you doing that you don't become one? Is it you're not a go-getter, or you're not doing, overcome the job of duty? So we want them to also look at how to maintain that job and how they may be promoted. We look at their personality. Can you get along with folks? How do you communicate skills? So it's more than just getting the job, but keeping the job, kind of looking at your communication skills, and then identifying your pyramid, which is your goal. What is your plan for the future and things you need to work on? We would love for them to walk out with a resume. master application. Just because you have a job, you still need those tools because you do want to benefit you in the future so that we can get you ready for work. And one of the last plans is, what do we need to do correct? What do we have to correct for you to get job ready, to keep a job, to get promoted, and to stay employable? So those are some of the modules and things that we kind of cover in the curriculum.
And I'll just mention about that, the workbooks are not PhD material that were usually written 5th to 8th grade level.
Mhm.
A lot of group exercises and drawing. So if a person has low literacy or isn't very engageable, both the group exercises as well as drawing activities, as well as the grade level of the workbook, such that really reduces the barriers for persons so that they can benefit from some of that. So that kind of summarizes it well, Mike. Thanks. And so the bottom line is it was the #1 guiding a philosophy or priority of the Impact Council and the Resident Council led effort. 2, it's really needed. 3, and we're really good at it. And we're asking for, I think, $51,500, not counting the in-kind contribution from the Salvation Army.
And one thing I would add is because of our skill set, even though it's targeted towards employment, if we get a person there with other issues, you have trained staff that are trained in substance use disorder, screening for mental health. If they need help with reading, if we ran into some employment stuff, because in justice services, I deal with transportation, housing, mental health, development, disability. They're able to could have some sidebars for that person and say, hey, I know we're dealing with this, but this might be a referral for you that might could benefit you because you're saying I never keep a job because I have a substance use disorder. Even though this is not what the class for, here are some resources if you think you need additional help. So I think our skill set in being trained in this curriculum would also be helpful.
That's a lot, wasn't it?
I think we did well. So I was wondering if you could talk a little bit about, so on 4th Street, you have an office on 4th Street, and you talked about the cognitive behavioral therapy or intervention that happens there is tailored towards offenders, ex-offenders, and reentrants. And so is that a focus here as well, or is this more tailored towards anybody who is underemployed? Or
It should be more for anybody, Alana. Clearly, many people are more comfortable with their own groups and things. Michael's CBI class is over on 4th Street. It's in the Lowy building, not in the Insight building, but in the Lowy building where the justice are Lowy.
Yeah.
I always say Lowry. I thought there was a R. There's no R's. There's Lowy.
It's spelled funny.
Oh, Siri doesn't understand.
No, that's right.
That building, where the housing authority is, I just learned the Lowy building. But that building has that specific focus in a contracted Department of Public Safety. Why this was exciting for us and interesting is persons that need that service are going to go there anyway. But this is not for those folks as much as folks in the community who are under or unemployed. One of the questions from the Impact Council,
people in the community that need the services, #1, and then how do we tap into their gifts, skills, and talents and their interests and merge those together with the program outcomes.
Right. If you gave me that and I saw just demographic information, it might help me in identifying who would be the best instructor for this particular group. Or if it was a lot of Hispanics, maybe I need my bilingual person to do the group. If it was more unemployed when I saw the demographics, my focus might need to be at a certain module starting off. Or if I saw most people do have a job, but they're trying to, XYZ, that's where I could use it initially until I build on it.
Okay, and let's say you found that list and you've seen on there that you had a lot of people that were artistically gifted, that loved art, that were really good in art. That's the interest of theirs,
Yeah.
right? That's the interest of
Yeah.
theirs. They have a passion around it. How do we take that passion that the people have and either connect that passion to keeping them interested in the program or connect that passion to actually finding them employment, whether it is employment in the community or whether it is something that's creatively, something that they create?
Okay.
How do we support them? How do we
Okay.
support people
Okay.
in utilizing their gifts, skills, and
My
talents?
first thing would be to do is, wouldn't be a part, it could be here, because once you change evidence-based practice, it's changed. But I could do an exercise before I start through with drawing. So I want to see what their potential is and keep that a part of the